Hello, Healy family. Thank you so much for joining us today. I'm so happy to see each and every one of you. So today we have an important topic, and it's a topic that will benefit everyone because respiratory infection is very, very common. Yeah. And the breath that we breathe every moment, every second is so important to keep us alive. Yeah. But I'm sure that there will be something that we can learn today, something new as well. Okay. So before we begin, as usual, we will do the disclaimer first. So, the information that I'm sharing today is purely my own personal experience. All right, it is not something recommended by the company, but this platform is provided so that we can share and learn from one another. Okay, so before you apply what you hear from my sharing today, please use your own discretion. And as you use it, you have to actually follow, listen to the body, how the body respond. Does it feel good or do you have concern? So uh, adjust, okay? Adjust according to your own discretion and judgment. That is very important because every body is actually different. Okay, how we respond, how fast we respond is also different. Okay, so the and MagHealy programs, okay, they are not medical application, so therefore do not treat this, as a cure or treatment or for diagnosis or to prevent any medical condition. So should you have any medical concern, my advice is always okay to seek medical advice, and we use Healy and MagHealy to support, okay, support our bioenergetic field so that you can actually recover faster, okay, by harmonizing your bioenergetic field. That's what we want to achieve. So this session here is recorded and it will be put online on social media. So if you have questions later on, you can either put them in the Zoom text if you do not want your voice or face to appear, okay? Or if you do use the mic or video later on, okay? So yeah, your identity will be revealed. All right, so let's begin. So for those who do not know me and is here for the first time, welcome, welcome, welcome. And for those who have been here for many, many times, I really, really appreciate your attendance here, and I'll do my utmost best to share my knowledge with you. Okay, so I've been using bioresonance for over 8 years now. So I do bioenergetic profiling to help people with health, relationship issues, etc. Okay, through harmonizing the bioenergetic field. All right, so I am an A-level biology educator. So that's why today, when I talk about health, I will share, okay, the biology of our respiratory system. Okay, so for those who likes to delve deep into understanding the Healy and maximizing the potential of Healy, so there are books, okay, that I have compiled together that is available to you if you wish to purchase. And then I have my own YouTube channel where I will share other knowledge that I have as well. Okay. So let us begin. So today we are going to cover, we are first going to talk about the respiratory system, so a bit about the biology, and then what are some of the common issues that we face regarding our respiratory system. Okay, and what are the Healy and MagHealy programs for each of those issues that I'm going to talk about. And of course, at the last bit will be about breath works, how to breathe properly. And you'll be surprised, okay, that some of us are not aware that we are not breathing correctly. Okay, so the breath of life. This is the very first thing that we do the moment we are born. Okay, that first cry is so necessary. Okay, so if the when the baby is born and the baby is not crying, the first thing is they will put the baby upside down and then hit the chest, right? The back of the chest to get all the fluid out. And the first cry is the sign of the very first breath. That means sucking or inhaling air through the respiratory system. Okay, so it is the very first thing that we do when we are born. Okay, yeah. So we are going to start with the biology of the respiratory system. First, it comprises of airways. Airways are spaces, the hollow tube where the air can go in. So our chest is here and the air outside, okay, may be of a different temperature. So if you are in a place where you have winter, the outside temperature may be 0 or negative, and then the body temperature is 37. So it cannot straight away have that cold air go directly into the lungs because your lungs may be frozen by very, very cold air. Then everything will harden, right? Imagine your whole lungs become frozen because of the 0 degree air that you breathe in. So therefore, your air has to be warmed up. So as it passes through your nasal tract and your airways, your body temperature will warm up the air so that by the time it reaches where it reaches your lungs, it's all properly warm up to the body temperature. So that's one. And then the other one is that sometimes we live in very polluted places, yeah, with dust, construction. If our work requires us to work under dusty places, renovation, carpentry work, woodwork, painting, okay, and then what else? Yeah, this kind of work. Then, or even cooking, if you're a chef, right, you will be breathing in a lot of particles. So these are all dirt. Is so you have to clean it. So when it passes through the airways, there are lining of mucus that will allow these particles to stick so that you clean the air so that by the time the air reaches your lungs, it is nice and clean. So germs, everything will have to go through airways. So that's one part of our respiratory system. The other part is where the exchange of gases takes place. Okay, that's where the oxygen in the air goes into your blood, and then the carbon dioxide from your blood actually comes out of the air that you exhaled. Okay, so the exchange takes place in the lungs, the way deep inside, which we are going to see later on. Now, because carbon dioxide is dissolved in your blood, so it can become carbonic acid. Okay, so the other function of our respiratory system has to do with regulating our blood pH. Okay, so those of you, let's say if your body is too acidic, acidosis, or too alkaline, okay, then what happens is this is another way to regulate your blood pH other than the kidney. Okay, so by removing the carbon dioxide from the blood. So if you're not breathing properly, the CO2, right, carbon dioxide is not expelled from your blood. So it can actually lower your blood pH as well. Okay, so that is also not good for you. Okay, let's look at the airways and the programs that you can use for it. So the airways is a tube. Have you seen the washing machine tube where the water flows out? And it has ridges on, right? It's not those smooth tube. You'll find that the washing machine tube actually has a lot of ridges. So our airways is something like that. Okay, so our airways, if it's just a tissue tube, like you see here, behind here, That's the esophagus. That's where food passes through. Okay, it will actually collapse like this. So if it's wet and if it's collapsed like the esophagus, then what happens is air will not be able to pass through. You see or not? But for food, it's okay because for food is hard. So when the food passes through a collapsed tube, you will force it open and then the food will pass through. But air is different. Okay, so when you breathe in the air, if the air is like, plastic bag, right? Plastic bag, if it's oily or has water, the two sides actually stick together and there's no way the air can actually force it open. So therefore, it has to be forced open or kept open with cartilage. Okay, cartilage is the material for our ear. Okay, our external ear here, so that is that hard material. It's C-shape, C-shape like this. Okay, so it actually act as the extender to force it open. So it will never collapse with the cartilage, but cartilage can get worn out. Okay, yeah. So what happened is if you have breathing difficulty and if you find that it's because the cartilage is degraded and therefore not doing its job properly and is collapsing, so use what, use skin program because cartilage, collagen, all this is actually related to the skin program. Okay, skin program is very good for the replacement and repair of your cartilage, connective tissue in Meridian, or you can use vitalization tissue, okay, or MagHealy under the MagMakin soft tissue or even skin program. Okay, so this can actually be helpful to the cartilage to keep it open all the way until all the very, very fine branches. Yeah, so that is to keep it open. Okay, now, so the air is directed through the airways and it comes here, bronchiole, so through the trachea, bronchus, and then to the very fine branches called bronchiole. So the air has to come all the way here, and then exchange of gases takes place in this great looking thing. So I'm going to play the video. I do not know whether it will be loud or soft on your end. You just adjust your volume accordingly. So let's watch how the exchange of gases takes place.
When you inhale, air travels down your trachea, through the bronchi, and into smaller bronchioles, finally reaching tiny air sacs called alveoli. Alveolar macrophages are immune cells located in the alveoli. Their main job is to keep the alveoli clean by engulfing and digesting debris, bacteria, and other particles that enter the lungs. Alveolar type 2 cells produce surfactant. This is a substance that reduces surface tension within the alveoli, preventing them from collapsing and making it easier for them to expand during breathing. In the alveoli, oxygen from the air passes through the alveolar walls into the blood and the surrounding capillaries. At the same time, carbon dioxide from the blood passes into the alveoli to be exhaled.
Okay, all right. So you can see that on the surface of the alveoli, there are also immune cells, in case you breathe in any germs. So there are immune cells lining there to also protect you as well. Okay, so you can see how it actually inflate completely. Okay, yeah. And the inflation is actually to draw all the air in. So when you inhale, inhale fully. When you exhale, exhale fully. Because sometimes if you do a very shallow breathing, the stale air, S-T-A-L-E, stale air remains inside the alveoli, so it's not actually replenished with fresh air, So sometimes we only breathe very shallow. Yeah, so we don't expel all the dead air out. So you don't get to maximize the oxygen exchange. Okay, so even as you listen to the talk, right, what I want you to do is observe your own breathing. Does your breathing becomes very shallow, or do you actually stop breathing? Some of us do, and then we do it unconsciously. Okay, or are you every moment, okay, that your whole lungs is moving? Yeah, your whole entire abdomen is moving. Do you go very, very deep in terms of your inhalation as well as
When
your
you
exhalation? Okay. Yeah. So for maximizing oxygen intake and carbon dioxide removal, you saw just now there were a lot of capillaries. So circulation is very important. So sometimes in your 5 by 5 analysis, if you're coughing, if you are having breathing difficulty, you will see circulation, right? So meaning that is the flow of oxygen to try to increase the oxygen uptake and carbon dioxide removal. So circulation is necessary. And then you see there are several circulation. Harmony, you have circulation. Fitness, you have circulation. Meridian, also you have circulation. All right. Lymphatic. The lymphatic here will be for fluid removal. Sometimes there is accumulation of fluid, right? It's not flowing properly, so you find that it's hard to breathe, like drowning. And infection, if there's an infection deep in the alveoli, you will need the lymphatic as well. Okay, yeah. Now, breathing, how do we breathe? We don't breathe through your nose. I mean, we don't use or we don't change our nostril here. When you breathe hard, you shouldn't breathe hard at the nose. You know or not? Some of us like trying to do this. That's the wrong way because the air is not sucked in by your nose. You see or not? So it's actually a physics, it's a mechanical process. To draw the air in, the air actually moves through the passageway through your nose. But actually, it's not your nose that is sucking in the air or blowing out through your nose. It's not. What the proper breathing is actually we are controlling the rib cage and the diaphragm. Okay, where is the diaphragm? The diaphragm is here, okay, separating your chest cavity and your abdominal cavity. So there is a layer of muscles there called the diaphragm. So the diaphragm is moving up and down. Ooh, up, down, up, down. Then you have the rib cage. So the rib cage are bones. So the bones is actually to protect the soft tissue of your lungs. It is a vital organ. Okay, not so the cage, rib cage is there. And then between the rib cage are muscles. Okay, so if you eat the rib bone, right? The meat that you eat when you are eating, enjoying your rib bone is actually muscles, okay, between each bone. So one bone is here, another bone is here. In between will be all the muscles. So what does the muscle do? The muscle, right, is actually what? Pulling the cage upwards or downwards. Okay. So when we inhale, we control the muscle at the rib cage. Okay. And we can control the muscles in the diaphragm. So what we do is when you want to inhale, when you want to do a deep inhalation, right? So what you do is your rib cage, feel your rib cage, put your hand by the side and feel your rib cage that when you breathe in, your rib cage is actually moving upwards when you inhale, upwards and out. So when you move up and out, it is actually increasing the volume in your chest cavity. And then the diaphragm actually moves down. So that is actually creating maximum volume. And when the volume actually increase, the pressure drop. So when the pressure in the lungs drop, the air in the atmosphere will automatically rush in because of the pressure difference. Okay or not? So when you have breathing difficulty, don't suck in the air using your nose. Control your rib cage. Okay, so you focus on the muscles. So your mental, your mind here is actually focusing on the muscle in the rib cage. Okay. So I'm actually lifting those muscles. I'm not using the muscles around here. Okay, now. So when you exhale fully, it's the same. When you exhale fully, is to let the rib cage drop down in, compress. So when it compress, and then the diaphragm do what? The diaphragm will contract and push up. So that's where, when the diaphragm pushes up, that's where the air, so rib cage force it down, diaphragm push it up. So it's like equivalent to squeezing the alveoli and then force the air out the nose. Okay? Try that. Practice that. Okay? What is a shallow breathing? The shallow breathing is when your chest don't even move. Means that you can sit down there. The chest doesn't move. Air is just going through the nose and then it does not go all the way in. If you're breathing, inhaling deeply and in exhaling deeply, when you sit down there, chest move. Chest is moving. Okay? Now, besides the chest, look at your abdomen. When you inhale, abdomen should be protruding. Why is the abdomen protruding? Is to create maximum space. Okay, so when you exhale, the abdomen also get tucked in, and then that whole force, everything is pushing the air out. Okay, so watch also your abdomen moving up and down. Not just the chest moving, but the abdomen is also moving. Okay, that's the deepest inhalation and exhalation that you can do. Okay, so what program that you use to strengthen all these muscles is under fitness. Okay, now as you age, right, it's not just this skeletal muscles here that actually degenerate, okay, and muscle loss, right? We call it muscle loss. I think it's called what? Muscle loss. There's a term for it. Yeah. So the intercostal muscles between the rib cage will also get worn down or degrade as you age. So does the diaphragm. Okay, so the diaphragm, right? You know, muscle is like that. Muscle needs that kind of resistance for it to grow. You see or not? So when you lift weights, right, you actually stretch your muscles and then it helps them to actually become strengthened, stronger. So if you have for a long time did not breathe deeply, so your diaphragm is not doing this action every day, you know. That means it's go down flat and then curve, and then flat and then curve, and then flat and then curved. So if it's not doing this action, like not flat completely, it's only doing this every time you breathe, then what happens is it does not get stretched, it does not get strengthened. The same thing as your rib muscle over there. Okay or not? So if you don't let it contract, stretch fully, contract fully, stretch fully, contract fully like this, then a little bit, a little bit, a little bit like this, not full, then it will waste. It will waste away because there's not enough exercise for all these muscles. Okay, now so when you go for your fitness, okay, don't forget, okay, to actually exercise all these muscles. You can actually sit there and watch TV and then consciously move all these muscles. Okay, consciously move them. Okay, so you can use all of these. Muscle strength, all right. Muscle harmony is to build the volume. Stamina is so that you can maintain your exercise and muscular activity while the lungs is working at its maximum. Okay, regeneration here for muscle that is wasting away, so you want to regenerate them. Now, deep relaxation is so that it can actually relax completely as well for you to stretch. Okay, so if you find that muscles are tight and then cannot relax to let it go up, then you can use relaxation as well. Okay, so this is actually good for also when you have breathing difficulty. Okay, now, how fast can you breathe? Okay, when you're exercising, so there is a certain rhythm as well, so that everything is aligned, your heartbeat and your respiratory activity must be coordinated. So nerves, so this will increase your fitness as well. So if you find that your heart rate does not change very much when you're exercising, so you want to improve your nervous function, so these are all the nerve program you can use. So vitalization nerve, harmony nerve, meridian nerve, and then in MagHealy you have your brain and you have your nerve. Okay, so you can use this, okay, to improve the respiratory and the cardiovascular coordination. Okay, now for your entire lungs, if you do not want to think about this and that and all that, so you can just use all this lung harmony. And then this is a deep cycle, breath of life, meridian lungs. And then this is nutrition, digital nutrition for your lungs. And then there is a new program, MagHealy Plus. There is a deep breath, okay, deep breath program as well. Okay, so those of you with MagHealy Obsidian, you can actually use that. Okay, all right. Okay, chakra. Now, if you have breathing difficulty or you tend to pant, meaning that you have no strength, you find that you have no strength to move your lungs. Okay, including those with spondylitis, where your spine is a bit crooked around the lung area and therefore crushing your lungs, etc. For energy for breathing, use this chakra. So you start from here, because why? Your nasal airways are all located here. Okay, now, so therefore from the third eye is also related to the brain as well, that is coordinating. So third eye, throat, and then to the heart. Okay, so the lung is on the upper chest here. So these three chakras here will take care of your respiratory system. So that's why I put here is for bioenergy, meaning that especially older folks, they find that they don't have that strength, that stamina to bring the air in or to push the air out. So they become very, very shallow in their breathing, so they don't get a lot of oxygen. So therefore, they also become very, very sluggish. All right. So to increase that oomph, okay, the ability to breathe with gusto, with strength, is chakra. Okay. Now, aging, to repair all these tissues, either from accidents or from aging, old age, degeneration, so you can use vitalization. Okay, so you use your regeneration 1, 2, or 3. This is to stimulate stem cells, or you can use the deep cycle renewal if you don't want to use all 3. Okay, then you go for your tissue harmony, go for your nerve. Those that I mentioned just now, use cell. So this is to regenerate your lung tissue. Okay, Then if you have cell wave, basically this is for all kinds of cells. So you can actually use any of the programs, in fact, all the programs here to actually maintain all the cells in your body. Yeah, okay. So it's very useful. You don't have to think or you don't have to worry which one to use. Okay. Because when you use that, it's basically for the whole body. Okay, now let's go to infection. Now, lung infection can be by virus, bacteria, or fungus. So let's say virus, the common one would be flu, COVID, for example. Bacteria will be tuberculosis. Okay. Fungus could be yeast or any kind of mold fungus. Okay. Now, where does the infection takes place? Usually the infection does not take place at the airways because there is a lining of mucus unless your airway is dry, meaning that your lining is not producing enough mucus, okay? Otherwise, it should be protected by the layer of mucus so that when the germs come, right, the sticky mucus will then stick them and then they become immobilized, they can't do anything. So most of the germs would have get stuck along the lining, but there will be some that manage to pass through and then comes all the way to the alveoli. So alveoli is a dead end. Okay, so it goes all the way, it's like a balloon like this at the dead end here. So when it comes in here, the part that will more likely get infected is actually this particular part here. Okay, because over here you're not supposed to have the thick mucus anymore because it's meant for gas exchange. So it is very delicate layer of cells, okay, that is moist without the mucus layer. Not supposed to have mucus. If you have mucus, then you have bronchitis already. So this is the least protected area. And this is the part where the infection can take place. And the infection will damage the alveoli and then it can cause scar tissue to take place. So you may actually see scar appearing in your 5 by 5, let's say after an infection. Okay, so that's because it has to do the repair over here. Okay, so yeah, so during infection you may want to use the lymphatic because the lymphatic is where you have your immune cells, so use that. Friendly flora here will be your gut microbiome, which actually help to protect us against germs, against fungus, and against harmful bacteria. Now, spleen, pancreas. Spleen is usually active when we have an infection. Okay, so use the spleen, support your spleen. Defense here is your immunity. Okay, tonsils, if you have sore throat. Impurity here is actually to remove toxins. Okay, so sometimes like virus or bacteria, fungal is their toxins that is actually causing a lot of irritation. So you may want to use impurity. So you can do your 5 by 5 and see what comes out. And then from there, you kind of know what is happening to your body. If you do your 5 by 5 when you have, let's say, a lung infection. Okay, yeah, so you can use lungs. The generic lungs program is to support the whole lungs. Okay, but if there's an infection, you use the specific ones to actually counter the infection and support your immune system. Okay, pneumonia. Okay, pneumonia is a terrible feeling. It feels like drowning, although you are in the air, because why? Your alveoli is filled with fluid, pus, inflammation. So it happens during infection, like during COVID. Those who actually ended up in the ICU is not because of the COVID infection, but because of the pneumonia, the inflammation, and then the whole alveoli get flooded, gas exchange cannot take place. So it's a terrible feeling. Okay, so to do this, you have to control the infection, especially when there is pus. Okay, pus will form when there's an infection. Your white blood cells actually engulf the harmful bacteria, viruses, fungus, and all that, and they get sacrificed and become pus. They're dead. Okay, so that's a sign of infection. So you counter it with defense, support your immune system. The ones that I mentioned just now, you can use all of that. Pure is the cleaning system. Okay, liver and kidney, and then your release is to help you to allow the phlegm, okay, and the pus to actually get coughed out. You know, coughing is not a bad thing. All right, you need to actually expel. So coughing creates that force to actually expel all this fluid out. So it's a good thing if you can cough. That means you have the energy to cough. When you have the energy and the strength, it can actually cough it out. Okay, so release is helping those if they don't have the energy, the strength, children or weak elderly, they don't have the strength to actually expel out all this pus and fluid because they're very thick and sticky. Okay, so it's not easy to get them out. So release all these helps to bring out all these, like clean all is to supposed to help all this. Okay, tuberculosis is progressive. Okay, so that means this is a chronic thing that you start by getting a mild infection. And if your immune system is not able to handle it, then slowly it progress. And then the bacteria will spread to different parts of the lungs and cause damage. So they really do cause damage because they form a lesion, means they form a lump or a clump of cells, okay, in different parts of the lungs. So scarring, okay, damage and scarring will take place. Okay, so it's progressive, meaning that when you first started, you don't feel terrible yet until if you don't take care of it or if you don't care about it, then it slowly starts to worsen. Okay, so for this, because of the bacteria involved, friendly flora, bacteria harmony here will counter all these bacteria and of course the defense program. Okay, so if scar tissue came out, then use the scar tissue program as well. Okay, so yeah, at one time there's no tuberculosis, but it seems to be making its comeback. In Singapore, cases of tuberculosis is actually increasing, but I do not know about the other countries. Yeah. Okay, now this is very common, allergy, inflammation, having lots of runny nose. Yeah, so this can be an all year round kind of thing. Okay, so this is the irritation of the airways, the lining. Okay, it irritates them. Okay, so for example, now is spring. So now is about the time where a lot of plants are releasing the pollen grains, grasses especially. So they are tiny, powdery, especially airborne pollens. Dust as well if it's windy. So when it gets to your respiratory tract, it will get stuck to the sticky mucus, okay? And it cause irritation. So you may get skin impurity, connective tissue, all this in order to repair and prepare those lining for producing even more fluid. Yeah, so fluid is not bad. When you have runny nose, basically it knows that there are a lot of things getting stuck on the surface. So you're supposed to clear it so that the fresh liquid will be there, and then you keep clearing it. So it's actually a good mechanism to keep clearing it, although it's a nuisance. Okay or not? But if you find that your irritation is there, but you are not able to produce the fluid, your whole airway is dry, yeah, that is even worse. Okay, so it's not a bad thing to have fluids to clear. That means your lining is actually good. It's actually having that protective function for you. Okay, now what happens is the irritants, pollutants, pollutants are usually chemical in nature. Pollens, dust particles, these are called irritants. Yeah, so when it damages, okay, it causes inflammation, and then the inflammation will cause the muscles to narrow, and then the fluid to keep producing a lot of fluid, so the airway becomes, the actual hole becomes narrower and narrower. Okay, so these are the programs that you can use. Skin is to repair the lining of the airways. Okay, scar tissues is for the damage. Relaxation is for the constriction. If you feel constricted, and cannot open up the airways, you can do deep relaxation. Okay, connective tissue or nutrients for breathing. Okay, let's watch a little video, short video here, what happens during asthma. Okay, asthma is also quite common for those who frequently get an asthma attack.
The lungs are built for flow. Air moves in, air moves out, smoothly. In asthma, the airways become reactive. Triggers vary. Allergens, cold air, exercise, infection, stress. When exposed, the airway lining becomes inflamed. Muscles surrounding the bronchi tighten suddenly. Mucus production increases. The passage narrows. Air can enter, but struggles to leave. Wheezing begins. Chest tightens. Breathing becomes work. This is not weakness. It is hypersensitivity. The immune system overreacts to stimuli that are not inherently dangerous. Inflammation lingers even between attacks, keeping airways more sensitive than normal. At first, episodes may be rare. Over time, without control, reactivity increases. Asthma does not mean the lungs are damaged beyond repair. It means the airways require regulation, a reminder that breathing is not just mechanical. It is immune, neurological, and environmental. And that airflow depends not only on lung capacity, but on how calm the airways remain when challenged.
Okay, so that's a very nice video. I like this one. So some of you request for the video. Zavok, you go to YouTube, you type in ZAVORK, Zavok, and then they have a whole range of videos over there. Okay, so you can go there and watch those videos and I can learn a lot. Okay, it's short, simple, and very easy to understand. And the animation is just very, very attractive and nice. Okay, yeah, so asthma is also inflammation, narrowing of the airways. The symptoms is actually very, very similar to allergy. Okay, yeah, so what's the
The
difference
lungs are
between asthma and allergy? I will talk about it later. Basically, they are overlapping. Okay, overlapping. Okay, yeah. So this kind of allergy can be actually caused by hay fever, which is pollen grains, allergic rhinitis. These are basically different terms to refer to the sensitivity to all these irritants. All right. So if it's irritants basically is along the nasal passage, because as the air goes in, all right, too much pollen grains around this area here, so it actually causes the reaction, sensitivity. Okay, yeah. Animal hair, animal dander is like the dandruff that comes from the skin of the animals. So every time they shake, then the dander flies all over the place. Pollen dust mites, huh? So it's an immune reaction, runny nose, sneezy, etc. Itchy eyes, fatigue. So you can use these programs here. Okay, all right, sensitive. And then Harmony also has sensitivity. And then Meridian has allergy. So these are programs that you can use. So if your eyes is itchy and watery, you can use the eye program. Okay, release is good for all kinds of discomfort. I normally use release, whether it's pain, itchiness, discomfort, all this you can just use release. Care, when there are multiple issues, you can just use care. So these are all programs that are very easy to use. Okay, difference between asthma and hay fever. Hay fever, allergy, rhinitis. So if it's acute, is mainly the upper airways. Upper airways means that it has not gone into your alveoli. Okay, so it's mainly around your nose, your sinus area, your eyes, uh, usually at the head area. Okay, but when it comes to asthma, or sometimes the hay fever or the allergy can progress to asthma. Okay, and sometimes asthma need not even be an allergic reaction. It could be sensitivity to cold air, stress, or when you exercise. Yeah, so it depends on your trigger. So if it's asthma, it tends to be the lower airways. That means it has gone down to the two branches, the bronchi, and then the bronchioles, and then after that the alveoli. So it has gone deeper down. So asthma is more that you feel the congestion, the difficulty at the lung area. But when we use the term allergy if you feel the discomfort more on the face here, the upper airways. That means your nose is blocked, stuck. That means you're stuck here rather than the congestion is deeper inside. Okay, yeah. So reaction wise can be the same because it leads to narrowing of your airways, inflammation, fluids, etc. Okay, yeah. Okay, now comes to lungs. The smoker's lungs. Okay, people who suffer from who are smoking or ex-smoker, where your lungs have been damaged by cigarette smoke, by nicotine, by tar. The blackish things that you see here is actually tar, T-A-R. So a non-smoker lung should be pinkish because of blood. It's very rich in blood, so it will be reddish, pinkish. And then the smoker's lung you see is blackish because of the tar. Okay, so again, there are similarity. Chronic bronchitis or acute bronchitis, anyone can have it, whether you're a smoker or non-smoker. But for a smoker, they call it COPD, chronic obstructive pulmonary disease. That means it is a bronchitis, chronic bronchitis all the time. Okay, so if you are a smoker or ex-smoker, or if you work in an environment like chef, if you're a chef, your lungs actually is somewhat like that of a smoker as well, because let's say when you cook, it depends on whether you use firewood, you use charcoal, and then the food as you cook also have all kinds of particles. If you work at the construction site, if you're doing renovation where there's lots of dust, so if you are exposed to a lot of this kind of dusty particles, clean do the cleaning first. Impurities, clean all, pure, all the programs for cleaning, use that first to stimulate the cleaning of the lungs. Then you do the repairing the surface. Okay, all the entire inner surface is actually skin. Okay, skin harmony, skin impurity, scar. Okay, so if let's say you find that you have respiratory issue and then skin program keeps coming out, that means there are scarring in the lungs, and then the whole entire lungs. Okay, lung harmony. Then this one is deep cycle lungs, meridian lungs. So when you use all this is to support the entire respiratory system. Okay, all right. So you can do it step by step, or you can do it all three at a time, one after another. This kind of programs to support your lungs. Okay, so difference between bronchitis and the COPD, the lungs. Basically, the bronchitis is more of the respiratory narrowing, whereas for the smokers, it is all the way, not just the airways, bronchioles, all the way to the alveoli because of the particles. Okay, so yeah, air polluted areas, if you live in those areas and you have difficulty breathing, basically they are overlapping. So COPD means is a much longer time already. So it goes into chronic. Bronchitis can be acute, can be chronic. Okay, acute means that if you happen to travel and you go to that particular area, then immediately your whole respiratory system reacted to that. So that is acute bronchitis. Okay, but sometimes people may have chronic bronchitis, meaning that every now and then you will get the kind of attack. So because of the thick mucus, so therefore you tend to expel phlegm, sticky mucus, and that requires a lot of force because if you cough, it's actually good to expel. But if you constantly have to actually cough, and it leads to damage. It leads to damage of your airways. So you may actually see fine capillaries broken and then a little bit of blood even. Okay, so if it's acute, it's reversible. If it's chronic, it has been for a long, long time. Okay, you have to be patient to work on it. I feel that body is dynamic. As long as you support it correctly, giving it everything that it needs, it is reversible. But you have to be very committed, very hardworking, okay, to apply all the good lifestyle besides using Healy, etc., to actually do the reversal. Okay, yeah. Okay, sinus. Sinus is very common too. All right. Blocked nose, this space around here. So if your headache, some people they feel headache at the above the eye here, above the eyebrow. So sinus basically means space. So there's space here above the eyebrow, the nostril, of course, and then below the eyes, you see sometimes people say the butterfly shape kind of thing. They get inflamed, and then you can see on the face the butterfly kind of mark. Okay, yeah, so it can be inflamed, filled with fluid, and then the fluid can cause either headache, tension, discomfort, etc. So, deep breath. This is under the McMakin Obsidian. Then under MagHealy, you have one specifically for sinus. Use this. It helps your breathing. And then you have head. Okay. And then skin harmony is basically for the lining of the entire sinus. Now, what people don't expect is large intestine meridian. Okay, not? So if you constantly have blocked nose and coupled with constipation, it is actually large intestine meridian that is blocked. So you may want to use this as well. Okay. Okay. All right. So I've mentioned all this. Now, nasal polyps. So polyps can also form in there, and skin programs may appear if there are polyps as well. Okay. So all this you can read it on your own. Okay. Snoring, how to use Healy programs to help snoring. I've mentioned this some time ago, but I'll just go through it again. Is because when you lie down, okay, the base of the tongue here is actually what? Loosen. You know, the muscles as you age actually loosen, so therefore it hangs down and block the airway. Okay, so you have to breathe harder, or when the air passes through, it creates the sound that we recognize as snoring. So you can use this skin harmony muscle is to actually increase the contractibility of the muscles so that it does not hang loose. Large intestine meridian to unblock this area. Your throat chakra, tonsils, sinuses. These are programs that you can use, okay, to improve on your snoring. Sleep apnea is similar to snoring but more severe, because in sleep apnea you can actually stop breathing momentarily. Okay, yeah, and the reason is the same, is the blockage of the airway because of your tongue, because of the muscle here is not toned, so therefore it drops and block the airway. So you can actually improve that with the same programs that you see just now. Okay. Now, the other thing is I mentioned about the momentary stop breathing. Okay, that one is because of the brain, the signal to the brain, and the muscles that actually initiate or trigger the breathing. Okay, so use this program, nerves, brain harmony. These two are in MagHealy. You can use the other nerve programs as well. Third eye, crown chakra. This is actually for the head region, head harmony. So you can use any of this. Okay, now this is the last section. You may actually, use so many programs and all that, but what if you don't breathe correctly? And many of us don't breathe correctly, including myself. Okay, I read one book, and then after that, I realized that I don't breathe properly. I breathe very shallow when I'm doing my work, right? So I'm only breathing around here. So I actually had to practice conscious breathing. Whenever I'm aware, it's like, okay, breathe deep. Otherwise, I'm very, very superficial. So you may be one of them as well. Okay. So what happens is that there was one book that was written about breathing. And in the research that they did, they found that as a whole species of humans, many have lost the ability to breathe correctly, and the consequences is actually terrible. Okay, when I read the book, somebody actually showed me the book and asked me to go and read it. He said, "This is so good." And when I read it, I was shocked that I was not breathing correctly. Okay, yeah. Some of us breathe through the mouth, especially people who have sinus. So because you have fluid and your nose is blocked, so what happens is you find that if you use nose breathing, it's so difficult, right? Because of all the fluid in there. So what happens is you start to breathe through your mouth. Okay, you can. But the thing is, your sinus will become worse the more you use mouth breathing. Yeah, it's like counter logic, right? So you thought that, okay, I cannot breathe in through my mouth, so breathing through the mouth is easier because there's no resistance. But the opposite is true. So when your sinus here is blocked, all the more you got to practice using nose breathing, nasal breathing. Okay, because what happens is this part here, your airways here will not open up if you don't use nasal breathing. So what happens is over here, right? Okay, I'm trying to look at the arrow that I'm pointing to over here, this part here. So you see from the nose, right? It goes in. So there are all these tissue here, but if you breathe in the air is going to constantly push in here. So it will be directed through the space here, go to the back. So when it goes to the back, it actually push it and force it open. So air goes in here, push against the top tissue here, go to the back, and then it keep the whole airway open. Okay, not? Yeah. But if you use your mouth, what happens is if you use your mouth, the air goes in here and then comes in here. So it bypasses this whole area here. And what happened is the tissue there, because there's nothing that constantly hit at it to cause it to contract and pull, pull, pull. The more it pulls and exercise, it becomes tighter. So when it becomes tighter, it creates a bigger airway. So when it does not get the stimulation, when the air goes in to tighten, right? Over time, this whole part here becomes loosened. So when it loosens, the muscles actually hang downwards from here. The soft tissue here hang downwards and close the airway even more. Okay? Yeah. So when do we actually do mouth breathing? Sleep. When we sleep, when you exercise, when you run, right? When you do a lot of your running on the treadmill, as you need more and more oxygen, when you start to breathe harder, do you find yourself panting? If you're doing during exercise, you're actually doing mouth breathing. You're not using nose breathing. So close your mouth when you're panting. Nose. Let the nose do the faster breathing, not the mouth. And we are not aware of that. Last time it was like, okay, breathe through the mouth. No, it's not. At no time you should breathe in through the mouth. Okay, now what is the adverse effect of mouth breathing according to this book here? Go and read it. Breath by James Nestor. So they had a lot of research done on people who have insomnia, people who have breathing difficulty, They found that many of these people are actually breathing in through their mouth. Okay, insomnia, it can lead to insomnia, headache, ADHD, learning disorder, mood disorder, hypertension. Okay, if you have hypertension and if you have used many of the Healy programs and it's still not improving, you may want to look at this aspect. Are you breathing through your mouth? Yeah. Okay, infection, irritation. Because why? Because the whole entire lining of your airways actually have a lot of immune cells. That's where they are positioned. Because why? Because biologically your air is supposed to come in through your nose, right? So the immune cells will all be stationed there waiting for any germs that will come in. But mouth is for what? Mouth is for you to put in your food. You see or not? So there is no immune cells until after the stomach because the stomach has the acid to kill germs. So your food may have germs. It's supposed to come in. They're not attacking the germs there. So if you breathe in through your mouth, that air is actually not cleansed, not filtered from dust, from germs. So you're actually allowing more germs to actually escape the filtering process and then go straight into your lungs. So that's no good. Okay, that's why you have more infection, irritation. So let's practice and be more mindful of breathing in through the nose. Now, for those of you who sleep with your mouth open or breathe through your mouth at night, I'm not kidding that there are stickers, there are plasters like this that you can plaster your mouth and force your mouth to close at night. So this actually force you to breathe in through your nose. Okay, you can go into the internet and check. There are all kinds of mouth plaster. Okay, you can use your own. Actually, you can just use a sticky tape and then you can just tape your mouth. So this is called mouth taping. Okay, mouth taping, and it's the actual remedy that doctors will give you also. Okay, mouth taping, yeah. Okay, so this is called mouth taping. You can actually tape your mouth as when you sleep. This is to prevent you from breathing with your mouth when you sleep. Okay, yeah. So this is supposed to help in snoring, sleep apnea, because it forces you to breathe through your nose. So I think some time ago, there are people who said that when they wake up, their mouth feels dry and parched. Okay, so it's because if you breathe through your mouth, you also lose a lot of water. So you can try this way as well. Okay, now breathing cycles. Okay, now there is this kind of breathing where you breathe in through your right and then you close it and then this way, right? So your nose, if you notice, okay, when you breathe out right now, right, you'll find that one side more air comes out than the other side. Okay, now so we actually switch left side, left side, right side. Either the switch is every 30 minutes or up to every 4 hours, it will do the switch. This is called nasal cycles, and it actually stimulate or activate different set of your nerves. So the right nostril, when the air goes in, when you breathe in through your right nostril, it actually stimulate your sympathetic nervous system. So it increase the circulation, your body temperature, your stress hormone. Cortisol will go up because it's supposed to be good stress. Your blood pressure will go up, your heart rate will go up, and then your frontal cortex, left frontal cortex, this side. So when you breathe in here, it actually stimulates the left side of your brain. Then when you breathe in through your left nostril, that means you can actually close this nostril, right side, you can press it to close it. And then when you inhale through the left, you are actually stimulating the parasympathetic, which is for relaxation. So it brings down everything. Okay, reduce your circulation, body temperature, cortisol, blood pressure, everything will go the opposite way. And then it stimulates your right prefrontal cortex, which is for your brain, for your emotional intelligence, for abstract thinking. Okay, there are breathing techniques there are breathing techniques where they you can actually do this, right? Press here and then the other finger, open it, and then after that you press this so that you can breathe in, breathe out using different nostrils. Okay, so there are breathing exercise which you can actually find many of the gurus actually doing that, teaching that. Okay, now nasal breathing benefits, they found that it actually increase 6 times the level of nitric oxide in the blood. Okay, so this is actually good for anti-inflammation, controlling your blood pressure, and then improve your circulation, immune function, normal weight. Can you imagine breathing wrongly can affect your weight? Yeah, so sexual function, mood. Huh? Okay. Then deep breathing. What's the benefits of deep breathing? Because I mentioned earlier that sometimes shallow breathing, how do you know your shallow breathing means that when you sit down there, your body is actually not moving. Your chest is not moving. That means very shallow. So deep breathing is to draw in fresh air all the way until the alveoli. And then when you breathe out is to expel all the stale air. Okay, so when you actually start doing this, you'll find your alertness, your mental alertness actually goes up because suddenly you get more oxygen. So by doing this, right, your heart can does not have to work so hard, because if you're not breathing fully, the amount of oxygen that you absorb each time is actually low. So your heart actually got to work harder to circulate your blood so that more oxygen can be circulated. But when you do deep breathing, you increase the exchange. Your heart actually need not have to do so much work. Okay? Yeah. So inhale slowly, counting 1 to 10 until maximum, and then exhale slowly until 10. Yeah, so that's what you can do consciously. Okay, yeah. Now, coherent breathing. Coherent breathing. Now, there is a new app that is coming, all right? And inside the new app, I'm using the app, there is this thing called coherent breathing. What is coherent breathing? This is what we call the perfect breath. Perfect breath, meaning that this is how we should be breathing all the time. All the time. In 1 minute, you can count right now when you are breathing, how many breaths in and out did you take in 1 minute? Ideally, it should be about 6 breaths per minute. So 1 minute is 60 seconds. Okay, so in 5 seconds, out 5 seconds is about 10 seconds. Okay, so it's about 6. To be very, very exact is 5.5. But I take it as 6. 6 meaning 10 seconds in, 5 seconds, sorry, 5 seconds inhale. So when you inhale, exhale through the nose. 5 seconds. In, out. In, out. So 1 minute, only 6. If you're breathing more than 6, you are hyperventilating, which is no good. If you are breathing less than 6, then you actually momentarily actually stop breathing. Okay? Benefits of this kind of coherent breathing. There are many YouTube videos you can find that they will guide you how to do the coherent breathing. You can use that, follow that. Long-term nervous system coherence, sustained relaxation. You feel calm, inner calm, and it's for emotional balance. Now, the other one is called box breathing. Box. You see here? 4 second, 4 second, 4 second, 4 second. Okay? Inhale through your nose, 4 seconds. You count 1, 2, 3, 4. Then after that, you hold your breath, 1, 2, 3, 4. Okay, and then after that, when you exhale, exhale slowly through the mouth. Once you finish exhaling, hold again. That's why they call it a box. 4, 4, 4, 4. Okay, this is when you feel anxiety, panicky. You can mindfully do what we call box breathing. Okay, or your meditation, you can do either box breathing or coherent breathing. Coherent breathing is actually what we should be doing all the time. Okay, box breathing is when you want to calm down or when you want to sleep. you find that it's very hard to fall asleep, okay? Or there are certain anxiety, certain pain, or certain stress, okay? So these are actually used by uh, people who undergo lots of stresses. So this is for mindful breathing, okay? Yeah, so you can do this to bring your nervous system down, to calm yourself very, very quickly. So this is also one of the breathing technique in the new app that is coming. Okay, give you a heads up. Okay, all right. So we've come to the end. I hope the session has been useful to you. So we talk about the respiratory system. We talk about all the programs. Okay, you can use them and deliver the frequency in three different ways. One is to use the electrode. This is the old original tried and tested way using microcurrent, and make sure that you don't have metals in your body. Metals means pacemakers, stents, all that. You cannot use uh, microcurrent. Okay, you will have to use coil. Coil is a wireless method and is through resonance. Yeah, MagHealy is suitable for everybody, so you can use MagHealy on the body. And then the latest way that we have that will go deep penetrating into your cells will be the high wave. Okay, so this is the high wave. And this month, there is a special promotion in Asia. I don't know about India, but in Asia, this month it is Singapore dollars 966 for the high wave. And then you get your free cell wave, 6 programs, mind wave, 6 programs that comes with that set. And on top of that, this is the first time this month that they are allowing you, giving you the extra benefit to replace your existing Healy device. So this is actually a very good promo for existing Healy users. Okay, you already have your device. So the 966 is inclusive of re- replacing your old device with a new one. Yeah, because if you get the replacement itself is already 500 Sing. So I find that this is a good value for money if you haven't got one. Okay, so for those of you who wants to share your benefits, your experience using McHealy, Healy, you can. I can give you the airtime. Okay, uh, yeah. So continue to share with all your friends. This kind of sessions here is, although we call it the Healy Advanced Training, actually, if your friends have the related issues, they are not yet Healy users, you can invite them to attend. Okay, because I feel that although they may not use yet the biology part and just listening to all the benefits of this program, uh, can open up their mind towards using resonance, using frequencies to harmonize their field, you know? Yeah. So please do invite them. Okay. So next week will be the question and answer session with Dr. Michael Chen, myself. It is bilingual. You can bring your question in Chinese or English, and then you have an alternative perspective from Dr. Michael Chen as well. Okay, so the session, if you cannot attend, will be recorded and placed in Facebook Experience Connect. This session here that we recorded, I will also put it there in Experience Connect so that it will be easy for you to access. And then sessions, the future sessions, I also posted there. Okay, so yeah, so that every avenue you can get the latest information. Okay, so that is the intention. And you can also share all your good experience in the Experience Connect so that other people can benefit from your sharing as well. Okay, and then May, second week of May, next session that we have for topical sessions like this will be a topic that many of you have requested. Okay, body slimming, how to lose excess fats from our body. Okay, and what are the reasons our body actually hold on to fats? Okay, yeah, so the recording for today is available in the official YouTube Healy World Learning Hub. Okay, you either go there to watch or you can go to Experience Connect to watch. Okay.